good afternoon, good evening from wherever you're joining us. A warm welcome to the session on technology and digital platforms for UHC. My name is Caroline Bindio, and I'm the Chief Executive of Amref Health Innovations. I'm delighted to be your moderator. As I mentioned, this panel session is on technology and digital platforms for UHC. The conference theme is a decade of action, and we have 5 fantastic panelists who will discuss how digital technology is responding in both emerging needs, such as COVID-19, as well as long-standing health challenges across Africa. We want to understand how digital technologies can drive the momentum to achieve UHC in Africa. When we talk about UHC, we are really speaking about health equity. We want to be able to provide quality, affordable, accessible healthcare to everybody, everywhere. All people, regardless of where they are. So we are not talking about Kenya, we're not talking about Africa, we are talking about everybody, everywhere. This is certainly a tall order. And as COVID-19 has so clearly demonstrated, UHC is not just a developing world issue. It is a global issue. Globally, we have seen health systems overwhelmed by demand. We have seen global supply chains decimated, patients unable to access essential commodities or essential services, millions losing their livelihoods, and public trust in health information eroded. What role can digital technology, data, artificial intelligence play in addressing this? To kick off this conversation, I will now invite each of the panelists to introduce yourself and answer our quick poll question, which is, are African countries ready to embrace the future of digital tech for healthcare? Participants, please go to the chat box and I will ask you to tell us what you think about this question. Are African countries ready to embrace the future of digital health tech for healthcare? So to the panel, I will begin with Dr. Beatrice Murage, who is a senior scientist and for health informatics at Philips. Beatrice, please introduce yourself, tell us a little bit about what you do, and answer our poll question.
So my name is Dr. Beatrice Murage, yes, Senior Scientist Health Informatics at Philips Research Africa, one of the 9 global teams that work on research and innovation across the world in Philips, and based out of Nairobi, at least for the Africa team. Also work very closely with our Philips Foundation and also the group sustainability. So it's a pretty big Philips family. And thank you so much, Carol, for the invitation from the AHIC team to just join this particular panel. I think I'll just dive into it. Are we ready as African governments? I'd say yes and no. Yes, in the sense that at a governance level, at a recognition level, at understanding that we do need, let's say, mostly just digital platforms and digital health to be able to progress the agenda of UHC. The recognition does exist. I'd say largely not, for 3 reasons. And it's mostly all the 3 reasons just they come together in something we call fragmentation. So fragmentation at the level of just trying to prioritize what level of digital health interventions or digital health priorities we need to pick. So you have a lot of solutions in the market, or rather just on the continent, but there's not much coordination at that level. So when you have an end user, whether it's your healthcare worker or a patient, or even just you and me, whoever is on this call today, you're presented with a lot of solutions. So there's too much choice. And I think just getting to see what works, a lot of fragmentation in terms of where my data goes. So that's quite a challenge, especially if you're looking to offer what we call holistic and end-to-end care. We also have fragmentation in terms of just the viewpoint. We see disease areas. We see, let's say, levels of care, either primary or secondary or tertiary, or let's say maternal child health. We're yet to really just integrate our vision in terms of looking at end-to-end care. And even just looking at clinical pathways. If I look at Beatrice as a person and I need to go and just get some care, do I see this person as, an integral person who goes through a system from one way to another? Or do we just see her, let's say, as a maternal child health client or an NCD client? So there's fragmentation at that view. We also have fragmentation in terms of just how we fund digital health solutions, especially for UHC, because if we do want to get to a place of equity, if we're not careful, we'll just enlarge what we call the digital divide and just cause a lot of inequity in the process. So we've not gotten to a point whereby, let's say, we put our money where our mouths are as African governments. We do have the goodwill, but I'm yet to see a lot of commitment in terms of investment, in terms of procuring, in terms of even scaling solutions. So we have what a lot of people, I'm not the first person to say this, an issue with pilotitis. We pilot a lot of digital solutions, but we don't get to scaling them. We don't get to owning them at the national level. A couple of African governments are making headway, but we do need to deal with that issue of fragmentation. So I'd say yes and no in a nutshell. Over to you, Carol.
Thanks, Beatrice. If I can summarize your answer, it feels like you're saying it's complicated.
Yes.
So moving to Seth, please introduce yourself. Seth is the head of exploration at UNDP. Really interesting title. Tell us what that means, what you do, and what is the answer to our poll question.
Thank you very much. And some interesting insight there shared by Beatrice. So I'm in charge of exploration for the Accelerator Lab. That essentially means looking out more and trying to identify what grassroots innovators are doing, not just in healthcare, but in other aspects as well. So going into the communities and finding out what are some of the interesting local innovators and how can we support them and help them to grow. So yeah, that's what part of what the Accelerator Lab does, but we're also focused on empowering local innovators to test and quickly grow their solutions. And as Beatrice talked about, that's one of the key challenges that we have in an ecosystem, the ability for scale and scaling up and scaling out, not just within the country, but also outside. So I think in response to the poll question, I think that we're ready, absolutely ready, but with a caveat. And the reason I think we're ready is, maybe let me use a few examples. More than 3,000 Rwandans are accessing care through Bebil Health, and which is using AI to triage calls to healthcare centers. You know, that's an interesting application of AI within the healthcare space. You know, Zipline is delivering COVID-19 tests and vaccines in Ghana, you know, as we speak. More than 2 million Africans are receiving access to essential medicines through M-Pharma's technology. So clearly, some of these examples, as dotted as they may be, show that we do have the tools, we know how to apply the technology, and the key question is, how can we, you know, create more examples of such? And our people are willing to embrace these solutions, as we can see. So how do we create more of such examples, and how do we design more around the local context to ensure that these solutions will not be just few dotted examples, but then we can have more of them, and they can help us to address some of the biggest challenges that we face, healthcare challenges that we face on the continent. So I think we're ready to embrace it, but we still have a lot of work to do to take it forward to the next level. Thank you.
Okay. Moving to Stefan, who is the CEO of Foundation Botna. Botna champions the use of AI and digital technology. So we may be able to guess what his answer to the question is. Stefan?
Yeah, thank you so much. It's great to be here on that excellent panel on today's International Women's Day, and I'll get to that more. The theme of the website on the International Women's Day is choose to challenge. So I would, my answer is to challenge. So I'm challenging Seth a bit. I actually think almost no government, whether in Africa or elsewhere in the world, even in Switzerland where I'm based, is not at all ready yet. There's probably Rwanda in Africa, and Seth referred to Rwanda, and probably Estonia in sort of the European context. And the reason why I say that is that most policymakers in government still have a very analog mindset in a digital age. And we think often analog and not embracing the digital policy implications. And I think that is a big challenge for all policymakers that needs to be rapidly addressed. So there's a lot of interest in digital solutions. There's a lot of excitement about digital solutions. But in terms of really the mindset readiness to really fully embrace digital end-to-end in an integrated, complex systems way, almost nobody is ready in the entire world.
Okay. I see Temi is giving you a thumbs up. He's next. Temi, you're next. Please, your intro. And I guess that's your answer to the question.
Thanks very much, Steph, for stealing my thunder on that one. But anyway, my name is Temitayo Bubu. I'm the Global Advocacy Director for MSD for Mothers. MSD for Mothers is a philanthropic initiative by MSD to reduce maternal mortality across the globe. And I must say, I'm really very much aligned with Stefan on this one, because I think with all what we have right now, we have the opportunity to leverage digital technology. But the question is actually, do we have the policies and our government making the kind of investments and donors making the kind of investments that show that we're willing to embrace what we have? And we also have strategies that are coordinated to leverage the digital technology that we have. So we actually held an event last week, a virtual event with DevEx and the global, the Bay Area Global Health Alliance, which is a coalition of tech companies working in the global health space. And the basic synopsis of the conversation, or the conclusion of the conversation, is that the biggest thing holding us back is not that we don't have the technology, but the policies aren't there to leverage the technology. And the investments that we're currently making don't reflect that basically we want to do that. We have from financing solutions to actually consumer feedback solutions integrated into platforms, and we know how to do it, we can do it, but the policies and the practices at a country level, or even anywhere, isn't necessarily demonstrating that. So I would say, unfortunately, no, but the opportunity is there.
Okay. And last and certainly not least, Thomas Onyango, who is the country director at Living Goods in Kenya.
Yeah, thanks, Karen. Thanks. It's great to join such a great panel. I'm country director at Living Goods. I think what we do, we really focus on partnering with governments to strengthen health systems. There's a lot of focus at the community level, really in time with even a more detailed focus really on child and maternal health broadly, of course, leveraging on technology. So very quickly to the question, Kara, I'm actually wondering, we may need to qualify the word ready, because there's a readiness of are things working now, okay? Or there's a readiness, are we ripe? So I'd rather take, so I'll say yes, and I want to qualify my perspective. I think Africa is ready for it from a point that we are actually ripe for that. And I've had a couple of examples shared by the panelists. If you look at the levels of digital, we are using drones in Ghana to deliver medicine. We're using lots of data analytics at different points of the healthcare systems, however fragmented they are. If you look at Kenya or Africa by and large, you look at a simple thing, digital, starting from very simple things like phones, okay? Things like transmission of money. So how do we shift this sort of mindset and bring it back to the healthcare landscape? So broadly, I think there's a need. But I think even if I look at it from the policy environment, from the government perspective, is really how do we all bring our hands together on deck as partners and support in rephrasing this and changing this progressively towards the desired goal. I also like the comment by Stefan about even Switzerland is not ready, then who is ready? So there's a continuum around it, but I think we actually at that right level. In terms of one I've described about being right, but in terms of the need, I think we even have a higher need, so then the readiness should even be more. We have a double disease burden. We have a significantly underfinanced system. We have more gaps than anybody else would feel. So technology is the only key thing that's going to make us move to move the dial forward in all those perspectives. Yeah. So I'll give an affirmative and open to further discussion. Thank you.
Okay, so a lot of things have come out of this, the issues around policies, the intersectionality of the issue that we're speaking about, investment, infrastructure, A lot of really good questions already coming up. And so I'll begin with you, Beatrice, and beginning with COVID-19. And with COVID-19, it has really fueled innovations in Africa. But none of these innovations will really contribute to UHC and the UHC agenda if we don't reach the most vulnerable, if we don't reach the people who UHC is really about. How can we ensure that digital technology is really used to democratize health and to transform both delivery and accountability of health services so that we actually leave no one behind?
Okay, we use very heavy words there: democratize, transform, accountability. So let me just unpack that before I dive into my answer. So when you're talking about democracy, that's a heavy word. So there's got to be a sense of opening things up, and just transparency, and the idea of equity. And you know, just thinking about that, it can be just a healthcare player's sort of play. Those are very heavy things to talk about. Then you talk about the transformation. So just probably overhauling how you do things. Accountability, meaning then I'm willing to open things up, that you see me, I see you. And we have some courageous conversations, especially about what is not working. And when you also talk about democratization, equity being International Women's Day. So when we look especially at our women and our children, and even just the other groups that are considered, let's say, very marginalized, and their voices not being often heard, especially in these kinds of discussions. So I look at it at two levels. So the way we are addressing it as Philips is that we first acknowledge that there's no silver bullet for this conversation. We do adopt one thing, a platform thinking and ecosystem thinking. So I think on this panel, I'm one who's very corporate in that sense, moving further and further away from just, let's say, shareholder value to stakeholder value in terms of the things that we do, being very purposeful in how we partner with the ecosystem and the players therein. And when we look at it, we're looking at it at an advocacy level and implementation level. So at Philips, we sit at different advocacy panels. So there's something we call the Digital Connected Care Coalition. I think together even with Transform Health, we even sit on the, like we said, the SDG partnership platform, at least in the Kenyan context, and also just a different MOH technical panels. So you work with your private sector, with your government players, because at the end of the day, really, especially in Africa, the main custodian, where the buck stops is really Africa. You know, and if you even go back to the things we've done with the Abuja Declaration, the kind of commitments and how that trickles down, you really do need to align with what governments are doing. Then you look at your UN and development partners, the NGO, you know, the Botna, the Philips Foundations, and even the people who are actually on the ground, even the social entrepreneurs have become a very important part of the ecosystem. So just getting to see at an advocacy level, we are progressing the policies. Here, I think I'll disagree a bit with Temi that we don't have policies. Policies do exist. In terms of our e-health strategies, e-health policies, it's now the level of implementation that we are struggling. And I think that's where we can even do better in terms of our partnerships to implement better. So like we said, this particular digital coalition has a lot of different players that are on the ground, including, you know, Pavel, including the different countries that we have. Then where does the rubber meet the road? Where does the policy then come to actually implementing things? And then we're looking at something I mentioned as a platform strategy. We need to move from just thinking applications, maybe a system here and there. And you know, as private sector, we've had a lot just proprietary. How can I afford your systems? So how we've worked together with even people who've been in the open, let's say, technology solution space to come up with platforms. Like Philips has something we call Phoenix, that's an end-to-end platform that can work with proprietary solutions of its own, that is open to even working with other solutions that can plug in, that we have an ecosystem play, so to speak, or an ecosystem awareness. And then at the end of the day, if we're going to talk about democracy, if we're going to talk about access to care at the very grassroots level, we must think about primary healthcare. And two things about primary healthcare. We'll have to think about our community health workers. How do we incentivize them? How do we equip them to be able to use, let's say, digital solutions that are relevant for their context, that they can be able to have that data collection, know what to do with it, secure it, be able to refer on that platform. And when you look at also your frontline healthcare workers, what we call our clinical officer, healthcare workers, we like to propagate that narrative that, you know, that has some fact to it, that just our clinician to population ratio is very low. And therefore we use it as, let's say, a platform to, like send our data outside of Africa, or let's say, let's focus on how we collaborate outside of Africa. Can we also include collaboration within Africa? So within Philips, we use simple things like even handheld technologies in terms of our ultrasounds, or even what we call our mom solutions, to create something we call clinician collaboration, whereby you can support your very grassroots, let's say, frontline healthcare worker with a consultant who's sitting, like, let's say, in your tertiary level. Of course, the underpinning bits about the ICT infrastructure, the things that we can do, not just as Philips, but with governments, with partners, that when you have, an ecosystem that works, that you can allow even conversations like task sharing to progress. We have to think outside the box and even just have a lot of, let's say, empowering at the grassroots level, whereby your first point of contact is your primary care level, and then just how you strengthen the entire referral chain. So that's how we see it. We need to move from fragmentation to, let's say, a digital platform play, and even just purposeful partnerships to be able to just progress that. Of course, with the financing and the business models that work for our context.
Mm-hmm. Okay, so Thomas, with UHC, we are really talking about reaching the most at need. And Beatrice has mentioned things around platform, ecosystem, stakeholder, really moving away from the unit to the collaborative. If we look at health technology, it has the potential to deliver healthcare when it's needed, where it's needed most, including across borders. Do you see health tech ushering in a shift in global politics, the geopolitics of our region, or fostering greater regional cooperation in managing things like disease outbreaks or delivering routine healthcare services?
Yeah, I think precisely spot on. I think there's a lot of room and a lot of need, both in terms of that. I just wanted to just start maybe from the very operational level. I mean, before looking at the system, just building on what Beatrice was saying. If we look at it and we talk about most at need, and we're talking about really precision health, targeting. And I want to bring it back home to the community level where all action starts. Broadly, I think we need technology by and large to ensure that that's happening. There's targeting. So the few resources that we have are directed to the ones who need it most at the right time. If you build it to the next level, and maybe this would come to things like standardized workflows, how do you ensure that people, because remember there are many health workers at that level as well. How do we ensure that we standardize outcomes? Do we standardize treatment regimens? We standardize outputs, but then aggregate these things at a much larger level, maybe at country, continental level, which brings us, Cara, to the point around the geopolitics. Right now, if you look at it, even in terms of COVID response, Africa CDC is becoming a really strong player, really because they are advocating for some needs that are very contextual. So based on all those things, you'll find, new groups emerging of either countries and continents based on similarities, which can be used for learning, for innovation, and also for scaling. So I think it's going to be a big influencer going forward. But this is also part of those systemization that we're talking about. How do we bring overall large frameworks, that bring overall large benefits? So I think it's a positive move, and yeah, a lot of scope around that. Thank you.
Mm-hmm. Mm-hmm. So Thomas has spoken about the community and really the grassroots needs at the community level. And my question to you, Tayo, is around, community health programs, which we have seen with COVID-19, but even before COVID-19, have the potential of identifying and addressing health challenges before they become a crisis. And therefore, they are really integral to the UHC agenda. But however, we look at things like financing these community health programs, there's really a lack of financing. And using technology, even at this community level, there's very little that is being used, and what is being used, is for very specific areas. Can we really leverage technology to strengthen health systems at community level? Is that possible?
Absolutely. It is totally possible. And I refer back to my opening remarks, and that basically the platforms are there, not even in terms of the solutions, the technical solutions. The platforms themselves are even there, that basically can allow us to finance and actually track the progress in terms of and the care that people are receiving, and be able to sort of like, see what kind of interventions they've had, or results and impact those interventions have had, and what the consumer perspective is in terms of the care that they're receiving. So I'm not speaking in abstract terms. I'm speaking so like, based on the work that we've been doing with one of our partners called Farm Access in Kenya and in Nigeria through an initiative called Mom Care, which is a platform that allows women to save or access health insurance to look after their pregnancy, but importantly also directs them to a quality assured healthcare facility where the interventions that they receive can be tracked. You can understand what interaction they have with the healthcare professional, even down to what medication they've received, and what also at the end of the day, what kind of care what they viewed of the care that they received. And that all that data also stays there. So over time, we better understand what is working, what is not working. And so these solutions are there. And ironically, it's actually within those communities that it's most essential that we have these kind of services, because people don't have, they can not afford to lose their money, because they're really stretched in many instances. So these are the communities that really need them, because you want to make sure that every penny spent is a real value add. So where there are gaps, where they're not being served properly, you want to identify it early. And this is all about data. This is all about making sure that we have access to those information. And to that extent, when I said, we weren't quite ready in terms of the policy environment, this is what I was alluding to. In a country like Nigeria, which is the biggest country in Africa, as you all know, mobile penetration, as good as it is, it's only still 50%. Until we get to a position where literally we understand that having a mobile access or digital access is like having electricity. It is literally at that level. Then we need to be able to start understanding that this is not a nice to have. If I want to seek healthcare services, I need to have my mobile phone. I can have my digital record on my mobile phone. I can use it to access whatever service I need to have. For example, if you want to access family planning service, you should be able to do that with your mobile phone. You should understand, okay, look, what's around me, to be able to get to the healthcare provider that has the kind of services that I have. And we're working with another partner in Kenya on a platform called Ask Nivi. And Ask Nivi is able to, one, triage consumers to the care that they receive, as well as tell them where the facility, where the service that they want is available. As you know, one of the biggest gaps in terms of uptake of family planning commodities is often because people travel miles and miles, often by foot, to try and get to some of these services, and they get there, they stock out. How do you stop those kind of occurrences? Again, digital technology enables us to do that, but we must understand that basically, in order for this to work and to be, open to everyone in the community, people have to have access to the tools. And there, I think, we can do more, although we're heading in the right direction. One could argue perhaps not quick enough, but we certainly have the opportunity to do so.
So I think, Stefan, what Temi is making is the argument for digital technology to be like a utility service, that it's a right, that it should be available to every citizen. And if we look at, the population of Africa now, millennials and Gen Z, essentially those who are born after 1981, they are a digital native generation. They are generally fluent in technology. Increasingly, they are the creators of tech advancement, tech innovations. But we see that they are not included in a lot of the discussions, in the decisions that are being made around technology and digital health. Their voice is not heard. Why is this, and what can we do to improve youth participation and representation in this space?
Well, thank you so much. I mean, there's a couple of points I want to make, and I refer to that today we are celebrating the International Women's Day, and the sort of theme on their website is challenge, choose to challenge. And I think it is, time that we do challenge the way we actually develop solutions from we have methodologies called human-centered designs. We have long-standing methodologies of citizens' involvement or, participatory methodologies. Now let's take just our focus on Africa. I mean, the average age in Africa in terms of just the population, if you take the number of people who are aged below 30, it's the majority. I mean, so just from a demographic point of view, not to include at the core, not consulting them, at the core of driving future solutions, young people should be very much at the center. The same with women. I mean, women in most places make up majority because of higher earlier mortality of young people, of young male, because of risk behavior. But women are continuously neglected in data sets. So if we take clinical trials for a very long time, females were not included, in a meaningful way in clinical trials because it was seen with their menstruation that it's kind of a bit challenging to get them. So most medical data, historical medical data that's used to train these algorithms is basically built on males. And so we really need to fundamentally change in terms of how we engage with young people in these issues and as well be inclusive. The other challenge we do need to tackle is we have a total fragmented global landscape in terms of health data governance. It is basically, there's very little interoperability standards. WHO has developed now some guidelines and we really should adopt them in terms of fire, age 7 fire. Then we have the need in terms of, what happens cross-border? What happens with data that is needed for research? Now, fortunately, we have new technologies, specifically in data science and AI, called split learning or federated learning, where we don't even need to pool the data anymore, where algorithms can basically crawl and collect data and make sense of data without having to pool the data. So, but policymakers are fairly slow in bringing that to front. So I think, there are 3 key issues that I would like to bring up with your questions. First of all, we need to ensure adequate representation end-to-end in the design of digital solutions. And that includes human rights impact assessments. We have many countries, and there is an excellent report by Philip Alston, the UN Special Rapporteur on Extreme Poverty, who in 2019 wrote a report to the UN General Assembly called the Digital Welfare State. He makes a compelling case that many governments, we are stumbling zombie-like into a dystopian digital welfare state, where people start to be systematically discriminated against because of digital gaps. And I do think we need to take that serious, that companies like Philips, who are very advanced in this, but companies and governments, before they deploy digital solutions, and specifically with AI, we need to have end-to-end human rights impact assessment to make sure that these solutions are not going to cause harm unintended. And so I do think we need to take this much more serious in terms of citizen engagement and really understand what is AI, what is digital for the global public good.
Mm-hmm. Mm-hmm. Okay, and I think sticking with that agenda of youth, that theme of youth and inclusion, Seth, you have co-founded a health tech company. What would you say is the biggest challenge facing African innovators who are passionate about developing homegrown solutions to address their countries, the continent's health challenges? How can these challenges be overcome?
Thank you. I think I would build on some of the sentiments that Stefan touched upon, that to overcome these challenges, there definitely has to be a participatory nature of the way we do innovation. But to your question, I think if I'm pushed to come up with the biggest challenge, I'll say it's scalability. Ability to scale the innovations to more users or even across a particular country and across the region. But underneath that scalability issue are a lot of underlying factors. And I want to pick out maybe just a couple of them. The first is that, for healthcare innovators, you really have to come up with a way to overcome the systemic issues and constraints, some of which Temi also talked about. There's very low funding into public healthcare facilities. There's limited technical knowledge. If you go into many of our healthcare facilities, if you design something, you have to really make sure that you are not just focusing on the technical solution, but also how to overcome, some of these challenges. We also have a poor funding and a limited infrastructure, ICT infrastructure, some of which Temi talked about. If you design a solution, for example, and you have a facility up north of your country or outside the country, how do you provide technical support? If you have a large number of clientele and the internet connectivity is not very reliable, can you provide technical support across your country? So there are these systemic issues that hinder healthcare innovators' ability to scale their issues. And if you can't scale beyond the first few customers, you can't grow. If you can't grow, you quickly run out of cash and you will die. So scalability is a big issue, but underlying that are some really systemic issues that not just government, but public, private sector, other institutional stakeholders need to come together to solve. Now, beyond that, as a healthcare innovators, we also really need to think about, think beyond the technological solution. So it's all nice and good. There's AI, there's mobile technology, there's all these new fancy technologies out there, some of which can really help us come up with innovative solutions. But the challenges we face require more than a technical solution. It requires sometimes really tech training for the staff that we're going to use it. It requires ability, to really overcome, some of the behavioral issues that are endemic in these facilities. Sometimes you can design, for example, when we did build this platform for bridging the gap between hospital insurance companies. Well, one of the biggest challenges we faced was change management, because sometimes the people at the top of the facilities are willing to use the solution, but the users, for various reasons, are reluctant or have that, adamance not to engage with the solution. So there's change management, there are behavioral issues, and to succeed, you need to think outside the fact that, well, I know how to develop a software. What can I do to really help the users get to a point where they can engage with the solution? So that's one of the key issues that underline also the scalability problem. But to talk more about some of the things we can do or innovators can do to overcome this, I'd say the first thing is to really think about designing around the local context. And I know my co-panelists have talked about the reasons why they don't think we're ready. And that's exactly what I'm talking about here. We have all these issues. The policies are not being implemented, and we know. But sometimes as innovators, that's really the hurdle you need to overcome. So how do I get to the root of the problem? It's not because you can develop a solution, so you focus on the technical features. No, you first need to understand the root of the problem, how are users going to engage with it? And more importantly, like Stefan said, to overcome these issues, you need to think scalability from the start, to involve some of the users in the design and development process. That's the first way. You can come up with something that can work within the local context with all the issues they've talked about, and also which can scale. I think the second issue is really to focus on simple solutions and not on the technology, because if you design something that's simple, easy to use, it's also easy to maintain, it's easy to roll out, and then later on you can build on the solutions. So simplicity is really key to overcoming the scalability problem if you have a solution and you want to grow. And I think the third thing is really to think, again, back to the point about thinking beyond the technical solution, also thinking about the entire system. So who are the other stakeholders? Go out and build creative partnerships that can help to address the issue, because oftentimes, again, the issues are multifaceted. So you need government, sometimes we do need the government to support some of these. We do need regulators, yes. If you want to scale, you do need the regulators to come in sometimes to support your efforts. You do need also other private sector players. If don't go in with the mindset that, well, I have a solution and I can roll it all by myself. No, sometimes to be able to really implement across the geographical area, you do need other partnerships. And so going out and trying to find out who else is doing something that can complement my solution and can make it roll out much quicker is also very important. And I think, some of these are early or baby steps that innovators can take to ensure that they are not bitten by the scalability issue. Because if you can scale, you can grow, and maybe you can raise investments to build a solution across the continent.
Mm-hmm. Okay, we have just 20 minutes and I want to squeeze in a couple of more questions. But Seth, let me stick with you. We have been talking about inclusion and we're talking about digital health, but we do know that at least half of the world does not have access to digital technology. I come from a rural village. Majority of the population in that village is definitely below the age of 30. So we would consider them, digital natives, but very few of them have access to a digital device. But many of them are creative. They are problem solvers. They are at their grassroots. They see their local problems. How can we get this group of people engaged with digital technology?
Thank you. I think this is an issue that UNDP recognizes and which we are also trying to solve. I think the first thing is really to also build our capacities to go out and identify these grassroots innovations. Currently, the efforts are siloed, and we're always looking in the same places, the well-funded labs, the incubators. But like you mentioned, the innovation is happening everywhere. So how are we going now? Is there a structured way? Are we collaborating to go into the communities and identify some of these local innovators who we would otherwise miss? And so I think that's the first step we need to do, because once we are able to do that, we can develop a more robust pipeline of innovators. We can build them up, we can support them to grow. And if we have a more robust pipeline, it means we can also attract more investment from the private sector, from other institutional investors locally, but maybe also foreign. So I think the first thing is really, build our capacities. And that's one of the things that UNDP Accelerator Labs is doing by combining various approaches, not just digital tools and crowdsourcing, but also on-the-ground solutions mapping, going to the community and identifying who else is doing something innovative that we would otherwise miss. I think the second point really also, back to addressing the scalability issue early is to empower these innovators to test their solutions quickly and rigorously. Often the focus is on, creativity. When we think innovation, we think creativity, we think something new, but the solutions we need are don't necessarily have to be new, but they have to work. And they have to work within the conditions where we find ourselves. So how do we empower these local innovators to test their assumptions, test it rapidly, and also help them to really, identify what would work so that we can help them to scale. And I think from the third point, really, we need to build domestic funding to support local innovation. There's this talk about Africa beyond aid now, but as we start to practicalize that, we will find that the money isn't going to come from somewhere else. Between 2019 and 2020, I think about 26 healthcare innovators raised $500,000 and more for their investments, for their solutions. You can guess where majority of the money is coming from. So if we really want to support healthcare innovations, everyone must come to the table in Africa. We have to support our own. One of the challenges we faced when we were running it was because we couldn't find, local investors to back us up. I know that has changed over time, but it's still not enough. So we really need to come together. Government, private stakeholders, institutional investors, individuals come together, pull domestic funding to support local innovators, because the critical startup years are really the toughest. You find a lot of innovators doing things that really have potential, but they fall off the scale because they die quickly and there isn't a lot of funding to support their innovation. So we need to, widen the pool of healthcare innovators, go out in the communities, identify. We need to support and help them to quickly test, and we need to build our own domestic funding to support these healthcare innovators.
Mm-hmm. Okay, so I mean, listening to all the panelists, one of the things that I've heard across from each of you is the role of policy. And I just want to ask you, Beatrice, based on your experience with innovation and R&D in health, would you say that government in Africa recognize that there needs to be a shift, a mind shift around thinking of policies that enable digital, or even beginning to build policy from a digital first perspective, thinking about the way they invest in ICT infrastructure, digital health systems, and collaborating with the private sector? Is there a shift happening in that space?
So is there a shift? Yes. That's the answer. From a policy level, is there recognition? Yes, there is. I think I just want to bubble the two examples that were given when we opened this particular panel, Estonia and Rwanda, and the need for just government to guide that innovation process. One of the things that is common between those two countries is just very deliberate guidance from a government level in terms of just ensuring that at that policy level, it's not just an e-health, not just for the ministries of health, but there's need to inform, educate, and include it in the policy for all ministries. So we notice there's still a gap in the ministries of finance, and I think probably even at the legislative, executive, and judicial level. So it needs to be an advocacy thing and policy thing across all arms and aspects of government. So in that sense, we're still yet to get there, but there is recognition. The other thing is when you're looking at an infrastructure, and I think also to respond to, I think, very passionate appeal made by Seth there in terms of financing, is a need even at the financial policy level to include digital health, not just as something that's healthcare, but as citizen, I think a citizen interest thing, the way we have for, for births and deaths and registration in terms of the civil bit, that universal just health coverage becomes a citizen-focused agenda, not just a healthcare agenda. Then at that level, even the financing needs to be availed. So when you're looking at financing, we can then just place the entire burden just on government. They have partners that work with them. And I think for us, since at Philips, both at Philips and at the foundation, we're very passionate about the innovation space and what can be done there. Just making policies become a reality, because it's great to have policies, but then we are seeing even in the chats, the issue is boots on the ground. Who's going to finance boots on the ground innovation? I think being implemented, being tested, and even being scaled. So government does play a very important role in all those spaces, but especially just adopting, what, let's say the different partners come and test it works, they really need to come and just adopt it, pay for it, procure it, maintain it, and make it work within, let's say, what's within their strategy. And at that national priority, national policy level, let's say priority, only the government can really give that kind of guided leadership, and then we come and support it. So I think I just want to make a quick mention here. Today, Philips launched in partnership with the Dutch FMO Bank, a catalytic fund, so to speak, let's say a funding opportunity that's very focused for primary healthcare strengthening, especially in sub-Saharan Africa. And they'll start out with about maybe 10, let's say, interventions, up to about €1 million each. And the thing is, for us, it's not just a discussion. So we go and we see government has prioritized it, the machinery is moving. As Philips, then we are putting our money where our mouths are, so to speak, to see how can we catalyze that innovation. But then we'll need all the different stakeholders to come in, and especially government, at the point of scaling, of taking it up, even just picking up the data and the lessons, the learnings, bringing the different stakeholders around the table and giving us what I like to call guided leadership. It needs to be very firm, that then we are not deciding for the African governments, because we're talking over 50, about almost 50, 54 different contexts, which are even more, it's not a homogeneous ground, it's very heterogeneous. And if you even blow it up to be beyond Africa, it's very big. there needs to be some guidance at that policy level. So there is recognition. We just need a little bit more guidance in terms of implementing and bringing the different stakeholders around the table to getting it done.
Mm-hmm. Well, fantastic to hear about the fund, Beatrice. I can see this is really a decade of action from your point of view. And I just want to, borrow the phrase that you use, boots on the ground. And if we look at, COVID-19, even before COVID-19, we see that human resources for health workers, they are overstretched, and technology has been one of the tools that has been used to fill that gap. And my question is to you, Tayo. How can we make sure that even as this technology is being used to bridge this gap, that the receivers of this tech-led healthcare experience, that they do get the human side, that they, we are using empathy and we are ensuring that their dignity is upheld, even as we use technology to provide health services to them?
Thanks very much for the question. And actually, from an MSD for Mothers perspective, this really speaks to the heart of the approach that we take in terms of our investments. We really believe that women should be at the center of the care that is given. And I refer back to the point I made earlier on around our investments with our partner, Farm Access Foundation, in Mom Care, which is this platform that basically is used to provide care and has been used in Kenya and Nigeria. And in Nigeria, it's in partnership with Lagos State government, which is, as you all may know, Lagos has a population of 25 million people. And so it's not a small geography by any stretch of the imagination. And what that platform allows us to do is to understand the care that women are receiving right across their pregnancy journey. And it allows them also to intervene, to give their inputs in terms of the care that they're receiving along that pathway. And that's so critical because it allows the healthcare provider and also government or any other partner that's working to be able to respond to what women are saying about the care that they're receiving. So again, I go back to the fact that digital technology is an enabler for us. It's not an end in itself. It's an enabler for us to be able to ensure that women are appropriately integrated into the system and they're being listened to. But you got to design that from the start. Going back to what Stefan said before, you can design a system that keeps women out of the process in terms of being able to respond, or you can design them in. And so I use a methodology that one creates a platform that they want and also ensures that along that journey, they have an opportunity to be able to give their views in terms of what kind of initiative, what kind of services they're receiving. And last but not least, I wanted to comment on a global initiative that we're part of called What Women Want. And what that initiative did was to really try to crowd in the voices of over 1.2 million women across the globe to say, what are your priorities in terms of care? What do you want to see? And to your point, one of the highest priority when you sort of aggregate all the responses was around receiving dignified care. So one of the things that we're doing at MSD for Mothers is how do we digitize that platform? This was done really going into communities. It was a handheld survey in many respects. What we're trying to do is to see how we can digitize that process and systematize it so that women can have a platform that they can utilize to inform policies and be integrated into spaces where, traditionally we're not perhaps, hearing those voices to inform care. That over this year, we're working with White Ribbon Alliance to ensure that basically this platform is available, that we can be able to crowd in the voice of women around healthcare priorities.
Okay, so we have just 5 minutes left, and I want to ask you, Thomas, in just 1.5 minutes, we've really been talking about digital health and looking at it from a curative angle. Can digital health be used for prevention, disease prevention, health promotion, and in terms of how can we use it appropriately, taking into consideration things like culture, language, medical literacy? Is that an option that is open to us?
Yeah, beautiful question, Carol. I think there is, and that's where I maybe as I give, because I think given the time, it's almost like those winding remarks. That's where the rubber meets the road. I think if we're talking about a health system, people talk about systems at different levels. A lot of focus really needs to happen at the pivotal level where it happens. It's at the household, at the community. And here is where we can leverage on digital, whether on whatever platforms we're talking about, standardization and efficiencies. I think part of those key things that the Living Goods where I work is really known for is performance management. And that's going to improve significantly. Even we talked about targeting, but overall in terms of visibility, accountability, and efficiencies at that level. If you can get it right at that level broadly, then we can magnify that approach to any formal framework across the board. You talk about things like preventive promotive, because again, if we talk about amplifying the overall health system, we know preventive is part of those key roles that drives, it's going to reduce the cost, drive efficiencies, keep us all healthy, but also leveraging on many other platforms around it. That's where we need to really drive it. So how do we target? What sort of information do we give those households? How do we profile them? We talk about artificial intelligence, target just enough information based on the family profiles that we have, improve the levels of awareness. And I think the action, that's, I be a lot of amplifying. I know time is short, but really that's where the game changer is. So even as we close, I think I really advocate for governments and all of us as actors to really double invest and start at that fundamental operational level. So it's the households and really at the community level. Thank you.
So I'll ask you, Stefan, to close us off. You've already spoken about data rights, about human rights, about respecting citizens, but you also started by saying that you don't feel that governments anywhere are really prepared. So I'll ask you, what do you think is the one thing that African governments need to do? What is the one step they need to take to accelerate progress towards UHC using technology?
I think it's the recognition that UHC will not be achieved unless we really rapidly scale up digital solutions that are fully integrated, they are interoperational, and really involve the young people in the design and into the innovation. I mean, I'm incredibly impressed by the incredible depth of innovation that young African people in the digital space are demonstrating. And if governments can get out of the way, in one sense, to create the enabling environment in terms of the standards and interoperability, and let people who are innovating at scale just give the space, things will happen in a tremendous rapid way. So, for governments to embrace the digital mindset, they need to partner with young people who are the digital natives. Without that, it will not happen. And UHC will not be achieved unless we have that rapid digital transformation that is human rights based and is really rooted in the meaningful participation of young people.
Okay. Thank you all to the panelists, to our audience. Great comments within the chat session. I really totally enjoyed this session. We could go on forever, really touching on the high points, equity and leaving no one behind, community empowerment, private sector engagement, innovation and entrepreneurship, the youth and the importance of the youth, mind shifts, and data rights. And, I'm really thankful to all of you for the fantastic session. And let us continue to engage throughout AHIC. There are lots of interesting sessions. We will have an open networking session immediately after this on the main conference link. So thank you all very much, and good evening and good day.